As we reported at the top of the hour, there is another highly transmissible coronavirus variant that has spread to the U.S. South Carolina is the first state to detect the South Africa variant, and some state officials there have confirmed 2 cases. Some health experts are concerned that the spread of these new variants, including ones from Brazil and the U.K., could ignite another devastating coronavirus surge.
What we're now going to see are these new variants, much more infectious viruses, much more easily transmitted, even causing more serious illness, are now going to overlay on top of that very high baseline. So what we can expect to see in the course of the next, I think, 6 to 14 weeks is something that we haven't even come close to experiencing yet.
Companies like Pfizer are working on boosters to combat these new variants, and a new lab study suggests that Pfizer's vaccine is effective. In the meantime, CNN has learned that President Biden's COVID team will meet with top vaccine distributors today as part of the administration's massive plan to flood states with millions more vaccine doses. FEMA is also asking the Pentagon for help. They have requested 10,000 troops be deployed to mega vaccine sites. New York's governor Andrew Cuomo under fire today. He is accused by the state's attorney general of severely undercounting the number of nursing home deaths from COVID by as much as 50%. These accusations come in a new 76-page report that was just released today, and CNN's Bryn Gingras has been following this for us. You know, this report, Bryn, lays out specifics from nursing homes across New York State, and it kind of confirms something that has been dogging the governor for some time. So tell us what you're learning.
Exactly, Brianna. And you know, the deaths in New York, as you're mentioning here in the nursing homes at the beginning of this pandemic last year, has always been a source of controversy in the state. You've reported on it several times. The New York Attorney General's office looked at dozens of facilities in the last year and found that significantly more residents died from COVID-19 in the state's nursing homes than what is reflected in the deaths publicly reported by the New York State Health Department. As you said, as much as 50% more deaths. Now, this is why this matters, because, you know what, this is providing some answers to families who we've spoken with, who you've spoken with, who've lost loved ones and felt that their deaths weren't being accounted for, that they weren't getting straight answers from the homes where their loved ones lived. And also, this is important because members of the state legislature for months have been demanding from the state an accurate count of how many nursing home residents died from COVID-19. So let's go back to the report. Much of the AG's findings released today stemmed from nearly 1,000 complaints about nursing home conditions. And the AG's office found some nursing homes were putting residents' lives at risk by not following infection control protocols. What do I mean by that? Well, not separating COVID-positive patients from other residents, not having enough PPE on hand, demanding sick employees, get this, still come to work or possibly be fired, also not properly screening staff members. Of course, all of this contributing to the spread of that virus among the most vulnerable. It's also, Brianna, important to note that the AG's office report determined the state's guidance to admit COVID-19 patients into nursing homes may have put residents at risk. And this is what you're talking about. This is a big deal, something you probably have heard about. It talks about the governor's executive order on March 25th that required nursing homes to accept patients who were recovering from COVID-19. That order, if you remember, was reversed in early May, and New York Governor Andrew Cuomo repeatedly has said that order was in line with federal recommendations and that the state was merely suggesting nursing homes follow it. Well, a controversial state health department report released last summer said the March memo wasn't to blame for an increase in deaths, but this report today questions that, saying, quote, nursing home implementation of some guidance may have led to an increased risk of fatalities in some facilities and may have obscured data reported by nursing homes. Now, Brianna, we have reached out to the governor's office and the state health department, and we are learning that we are expecting a response from them in the near future. Brianna.
Okay, you are expecting a response. And it's worth noting, Bryn, that, you know, in the early days of the pandemic, Governor Cuomo got a lot of, I think, positive attention for the way that he was putting forth a lot of information that was based on science and informing the public. It stood in contrast to what we saw coming from the White House. And he really did, I think, you know, enjoy the positive reviews of that. But this has been, we've seen sort of an effort on the part of his administration to not share data. That when you look at, say, New Jersey compared to New York, or you look at other neighbors, the numbers just don't add up. As you said, the overcount or undercounting by up to 50%. They stand in stark contrast. Do we have any sense why they haven't been particularly forthcoming as this whole thing has bubbled now for months and months?
No, and again, as you have said, this is sort of what's been dogging the governor's office, and you talk about the praise that he received. He put out a book himself. This is one issue that constantly comes up, even from state lawmakers who are of the same party as Governor Cuomo. So these are now going to be more questions that are asked, we know, from talking to many of those state lawmakers. But again, let's bring it back to the families, Brianna. I mean, these are families who we've talked to who just don't understand how they can look at a state number and see that in one particular nursing home where their loved one lived, one person died, and yet they know just from having a family member there that their family member died, their roommate died, and someone down the hall died. So there's just been such a frustration from these families to not just have these state officials say, no, okay, these numbers are wrong, let's take a serious look at them. And there are some people in the state, again, legislature that are doing that, but then there's also this other side that is fighting those numbers, saying they're pretty accurate. So this is to be continued.
It sure is. Hey, Bryn, this is such an important report. Thank you so much for bringing it to us. Not only are officials worried about vaccine scams, but they are trying to stop people who are ineligible for the vaccine from getting it before people who really need it. In northern Canada, a wealthy couple is accused of posing as motel workers to jump the line and get their shots. CNN's Paula Newton is here to tell us more about who these folks are and how they managed to pull this off. How did they do it?
Yeah, it's just unthinkable, isn't it, Brianna? Good to see you. And the issue here is, think about it, how scarce vaccines are right now. As scarce as they are in the United States, they're even more scarce right here in Canada. And in the middle of all that anxiety comes this couple. Now, people have called it stupid, idiotic, shameful, and that's just been the official reaction. Take a listen.
The alleged incident seems unthinkable in its deceit, and officials say residents are still shaken. Authorities in the Canadian territory of Yukon allege Rodney Baker, a former gaming executive, and his wife, Ekaterina, from Vancouver, chartered a plane to a tiny community shortly after arriving in the Yukon, and allegedly posing as local workers, received a vaccine they weren't entitled to.
I think there's a lot of people that are really upset. There's a lot of outrage here still that people would selfishly come to the Yukon and put our communities at risk.
It happened in the tiny outpost of Beaver Creek, close to the Alaskan border. Authorities say the couple flew to the city of Whitehorse in the Yukon earlier this month, and instead of isolating for 2 weeks as they were legally required, they chartered a plane to Beaver Creek, where they allegedly knew a mobile clinic was setting up to vaccinate everyone who lived and worked there. Home to Indigenous communities, the Yukon is especially vulnerable to COVID-19 with few medical facilities. Canada has given Indigenous and Northern residents priority for vaccines, knowing lives are on the line.
They went to a small community, and that, I will tell you, Paula, that has sent a shock through our territory. I had 2 calls yesterday with all of the First Nation chiefs from across the Yukon discussing how we can be sure to keep everybody safe.
What has been so unnerving, say residents, is the fact that the Bakers broke quarantine, putting at risk thousands who have sacrificed so much to keep the virus from ravaging remote communities. CNN has reached out several times to the Bakers for comment and have not heard back. The Bakers were charged under the Civil Emergency Measures Act, not for getting the vaccine, but for breaking quarantine. Fines can reach $500 Canadian and up to 6 months in prison or both. The Bakers were each fined the maximum and a surcharge. And the Royal Canadian Mounted Police tell CNN they are still investigating. While the couple has not been fined for actually getting the vaccine, the Canadian minister in charge of the vaccination rollout in Indigenous communities says the Bakers should do more.
I'm disgusted. I understand these people are wealthy, and I won't tell them what to do with their money, but, perhaps reparations are due of some level.
Yeah, and imagine, Rihanna, they still haven't gotten so much as an apology. We have also, of course, reached out to the Bakers, nothing yet. But given how hard this community has worked to keep COVID out, the fact that these people would jump the line to get a vaccine to a place that really needs it, that they don't have hospitals that you and I can go to, with a car ride, it's just been appalling, and the backlash just continues. Brianna?
Yeah, flying their private jet in to pose as motel workers. Paula, thank you for that report.